What are some things that we can do to prepare for a healthcare crisis?
That's a really good question. And I think one of the main things that I often tell people is first they have to have all their documents in place so that they have a healthcare power of attorney and they look at these documents and not just leave them safe in the drawer, wherever, to make sure that the person who is designated as their healthcare or their durable power of attorney for finances is still capable of doing it. A lot of times you have a spouse that you have selected, and now that spouse has Alzheimer's disease. That's, they can't do their job there. So we try to do that. We try to look at the legal documents and make sure that they are still in place, to have some sort of discussion about what your desires are with your family. And I know this is the hardest thing that people do, is trying to, broach that topic of, what do you want in case of an emergency? What do you want? Everybody says, I want to stay in my home no matter what. I try to keep people in their homes. And I say, as long as it's safe and it's financially feasible. So we need to have these documents in place. We need to have the conversation with your family members to see what they want. And a lot of times I hear people say, I promised my mother I would never put her in a nursing home. Well, mom is unable to stay at home, and caregivers at 24 hours a day are very, very expensive. That's more expensive than a nursing home. We try to make sure that they are safe in their home. Oftentimes we have them wearing the personal emergency pendants, so that if there is an emergency, they can either press for some help, or if they fall, they have auto fall detection on that. And if they can't speak, that will automatically bring out the EMS for them. So that's a very important piece.